that we use every year.
So that's essentially we could schedule a plane crash
Yeah.
at 747 at LAX once a year and do it in one fell swoop. That might make more news.
Well, it would.
Yeah.
It would, because what we think people need to focus on is these kids who are dying are just not nobody.
Right.
The newspapers don't run their picture every time it happens. They're somebody's child. Somebody has lost a child, and we think that if people really personalized it, maybe they would get involved, and that's what it takes. It takes people getting involved in all the neighborhoods to work on this issue.
Do you think we're, I mean, obviously as part of the media, do you think that we're desensitized? Do you think that, first of all, do you think the media itself has helped society desensitize, and do you think society itself is desensitized? We're so kind of removed from it. There's that screen around the picture that kind of, well, that's not, Survivor's real, but the rest is all kind of...
Isn't that funny that Survivor's real and kids dying on our streets of our city are not real? I think the media has a role. I think that when you continually bombard people at the 6 o'clock news with bodies and death and dying, that happens. I think that there's been a desensitization. There's also been the media not really giving the true picture. When they talk about something, it would be so much more helpful if they put it into context. People would feel like there was something they could do. I think part of what happens and part of what we work very hard to do is demystify what's going on so that people can't say it's happening over there, but it has nothing to do with me. The fact of the matter, it has something to do with everybody. Domestic violence happens in all neighborhoods. May not get as reported as often, but it's there. Child abuse happens. Sexual assault happens. People need to understand that as long as you allow it to go on and don't take action, it will continue to be not focused on in a way that makes people understand that there is something they can do about it.
Now, what about Hollywood? I have a position on it which I won't share because I'm not the guest. People tend to kind of throw this, well, it's Hollywood's fault, which I think is a great way of deflecting blame, and say, well, it's television shows or it's movies or it's video games. What is from a health aspect? What's the truth on that one?
Have you ever seen the media in Japan?
No.
Okay, it's very violent. It's probably much more violent than our media. They don't have what we have. Israel and Switzerland have guns in every household. They don't have what we have. They don't have the kind of violence we have. Our violence level is 10 times higher than most of the industrialized world. What really the public health approach says is, even if you took all the guns away tomorrow, maybe we would have less killing, but we would still have violence, because it is a perception. It's like smoking. Smoking in California used to be considered a community norm. Everybody smoked, everybody did. Now you don't dare light up any place, because the normalization of smoking has been changed. What we really think about violence is that it's the same kind of thing. It takes a huge change to change the perception that violence is not acceptable. It is not okay. It's not okay for a teenage boy to smack his girlfriend across the face, or for her to smack him, for that matter. We have to change it. So obviously getting guns off the street would reduce it dramatically. Obviously the kid who has a violent environment, they have a violent home, they've been abused by their parents, they have no support system at home. What Hollywood produces will probably affect that child differently than it will affect a child with a healthy environment. But the fact of the matter is, it's more than television. They've got a role to play, obviously, the media does. Certainly guns have a major role to play in this, but it's also the fact that we allow violence to be everywhere, and we glorify it. When you talk about American heroes, they're all violent. We use it in our songs. Everything that we do in the past has perpetuated it and glorified it. So it's I think the media comes in for their share, but so does everybody else.
We're going to be ending in a few minutes, so before we run out of time, I want to make sure that you have an opportunity to tell people how to get hold of you. Could you give us the phone number for the coalition, so if people want to volunteer, want to get involved, or need help, what's the phone number there?
The phone number is 213-351-5224. Once again, 213-351-5224. And we can, if people want to get involved, there are organizations all around the county that are members, so you don't have to come downtown where we are. We can put you in touch with an organization that almost of any kind that you want to be involved in, and if you want to help. And the other thing we can do is if you need some assistance with something, we're happy to make a referral for an organization or somebody who can help. And further, if you're thinking about doing something in your own neighborhood, putting something together, which is really the best way to address the issue, we're happy to provide technical assistance for that as well.
You have a website? We
have a website, www.vpcla.org.
Can you repeat that again?
www.vpcla.org.
Okay, and there's also, not to inundate people with contact information, but that's what we're here for, there's also a public health website?
The Violence Prevention Coalition is supported by the Department of Health Services, the Injury and Violence Prevention Program, and we have a website called www.lapublichealth.org, and you can get to the Injury and Violence Prevention Program on that website as well.
All right, well, I'll also mention, just to make sure people can go through us if they don't have time to get those, our website, of course, is accesstimewarner.com. Access Time Warner is all one word. We'll make sure that we link to your site so that people can get information from us as well, just in case they didn't get time to write yours down. I have to tell you, 10 years or more we've known each other.
That's
and
right.
I can still remember when violence prevention were just a few people standing kind of screaming against a very strong wind blowing the other way. And I'm so thrilled that you were the first guest on our show. I want to make sure that you know that, because I have admired what you've done, and I think a lot of other people should if they don't already. We only have about a minute left. If you could just tell anybody one thing that they could do to make things a little less violent, what would you say?
I would say, look at what you do. Look at the way you address things so that you serve as a model of nonviolence yourself. So instead of smacking a kid or instead of losing your temper on the freeway, there are other things you can do. Think about the kind of model you set.
Well, we really appreciate you being here, and again, thank you for all you've done, and I hope that some of our viewers will find the time or the energy to come and become part of what you're doing. And I just wish you the best of luck, and I hope 10 years from now we can have a little celebration of the fact that there isn't any. It's a little bit of a dream, but it's a good goal.
It is a good goal, and thank you very much for having me here today. I really appreciate it.
Well, thank you for being here. Leavenworth, and this is Community Forum, a production of Time Warner Communications. Our guest today is Billie Weiss. She's the Director of Injury and Violence Prevention Program for the Department of Health Services in LA County. Welcome.
Thank you. I'm glad to be here.
On our last show, we spoke about violence and violence prevention, but there are a lot of other risks to young people and to adults, a lot of them unintentional, a lot of them preventable. And I know that you've been working in this field for quite some time, and you're one of our resident experts, and we want to explore that a little bit this time. First of all, how did you get involved in preventable injury prevention?
Well, I'm an epidemiologist by training. I have a master's in public health from UCLA, and when I began with the Department of Health Services, I did, in fact,